This episode of the Burnout Recovery Podcast is brought to you by MEGA, your medical indemnity partner. Whether you're starting out in your career or have decades of experience, MEGA helps you thrive with support that goes beyond insurance. Enjoy travel benefits like complimentary travel insurance and Qantas points on your membership, plus education, medico-legal support, access to career coaching and wellbeing resources. Visit mega.com.au to learn more. Insurance issued by Medical Insurance Australia, which has not taken into account your objectives or situation. Before you make any decisions about our policies, please read our PDS and consider your needs. Call us for a copy or visit mega.com.au. Busy day, quick question, no time to dig. Heidi Evidence brings the evidence to you. Clear answers with citations you can trust. Completely ad-free, unlimited and region-aligned. Find evidence in the chaos. Search HeidiHealth.com.
Welcome to the Burnout Recovery Podcast, a guiding resource dedicated to healthcare professionals on their journey to overcoming burnout. Spearheaded by Dr. Joe Braid, a certified professional coach and rehabilitation physician.
Hello and welcome back to the Burnout Recovery Podcast. This week, I'm delighted to have a guest on the podcast, Dr. Ben Condon. Ben, welcome.
Thanks, Joe. Thanks for having me.
So Ben and I haven't actually met in person so far. I'm sure it will happen at some exciting conference, possibly CCIM in September. Ben is a doctor himself. He is a digital health innovator and he's the clinical director at Heidi. Ben and I have met through a coaching call before, so you can see we're both interested in investing in our growth mindsets. And there's so much more to your story, I'm sure, Ben. Please introduce yourself to my audience and give them an idea of how you've got to where you are now.
It's always hard when you try to think about how I got here. It feels like a really coherent plan when I tell it retrospectively. It was a bit of a journey and it was pretty unclear where I was heading, if I'm honest. But I graduated medical school and I really wanted to do plastic surgery. I've got a free flap in my left ankle. I had an ankle reconstruction, got infected in year 12 and spent 10 operations the whole term 3 in the hospital and thought I was going to have my leg amputated at one point. And then a plastic surgeon came and said, I will do a free flap. You can keep your leg. Mm-hmm. I think that just, I don't know, I'd always wanted to do medicine, but at that point, the idea of putting people back together in that same way was pretty compelling. And that experience, I guess, sustained me through medical school and through the first couple of years of internship and residency, and was really lucky to pretty early on get some experience at Peter Mac doing big kind of head and neck and breast reconstructions with the plastic surgery team. Mm. And I loved it. But my first job as an unaccredited registrar, it became really clear to me that whilst I could do the long days, the really long days, the calls overnight just did me. It was not sustainable. I'm not a very good sleeper at the best of times, and getting a phone call every 10 minutes was, it was not compatible with life. So it was like a really challenging, probably 12 months for me to acknowledge that actually wasn't going to be a sustainable path for me. And almost kind of like mourning that idea of what I wanted to. And then I kind of, honestly found myself into a spot, and the first time in my life I didn't know where I wanted to do. There wasn't a plan. There wasn't like a pathway that I was kind of gunning for. And that was really disorientating. I was really fortunate to kind of have some mentors that were in urology, and they kind of pulled me into a research group and tried to push me down that pathway. But again, I think it wasn't like having to recognize that whilst they were great people and I had a great experience, it wasn't the thing that I wanted to do. So then I took a job in emergency, really just to kind of reintroduce myself to the rest of medicine other than surgery. And within a month, COVID hit. So I ended up being in a COVID emergency department for the pandemic, which was like just a bizarre time, really scary. And I think it's just still unpacking that completely. But, the thing that stood out to me from my time in emergency, and particularly through COVID, was you see all of the shortcomings of the health system roll through your door in Cat 3s, 4s and 5s, and people that shouldn't necessarily need hospital care had they had an intervention some period beforehand, or they just have fallen through the cracks for whatever reason, and they end up in your door. And then the flip side of seeing the hospital like evolve so quickly to meet the needs of the pandemic really kind of showed me that actually change was possible in the right conditions. But I think then coming out of COVID, you see that the system is so stretched at baseline, maybe like there's just not capacity within the system unless you have this incredible stressor. But that kind of got me thinking for a long period of time about how else do you make change? So I thought, do I want to go do management consulting and kind of advise on change management, or do I want to jump into health tech? But I think what was clear to me was I didn't have a clear specialty that I wanted to pursue, and I didn't want to kind of do something for the sake of doing it. So, took the leap and started applying for health tech jobs, because I kind of was like, I think management consultancy is just going to be like being flogged as a registrar with a different title. Have a hunch this is going to be just as much hard work with some travel.
Right.
And then landed at Eucalyptus, which was a really interesting first place to land. I think they had a completely novel model of care that was quite, I think there was a lot of resistance to it from general practice and kind of the medical community at large. But I think what stood out for me is the way that they challenged your assumptions. My assumption as an emergency doctor was that people weren't willing to pay for primary care, because that was what my lived experience was in the emergency department. Turns out if you design a clinic that speaks to a patient where they're at in language that's familiar to them and their demographic, and make the care accessible and digital so that they don't, have to leave their office or their home, they'll pay a lot of money for it. They'll find room and the money to invest in an outcome. And that to me was really powerful, whether that be in the kind of men's sexual health pilot clinic or through Juniper and the pilot weight loss programs. Because most of those patients were coming to us having been to a couple of doctors and being told to just eat less, exercise more, and, not really helped in a way that we would hope that we as a system would meet people in need. So I think that was, lots of learnings about what makes a good business, the world of, venture capital startups and like a baptism by fire in many ways, but a really awesome experience.
Let's ask a question in there, if that's okay, Ben. Were you doctoring in the eucalyptus space? And maybe just tell my listeners, some of my international listeners, they might not be. Of course, I think we roughly know what eucalyptus is. So it's digital health.
Digital primary care clinics. So essentially they spin up a clinic to treat a condition or a group of conditions and market that to that population of patients. So they started with Pilot, which is their men's health brands. They did discretionary sexual health, hair loss, and then eventually metabolic health. Really with a point of difference is a lot of men don't like admitting they have having an issue, but ultimately they want their issue addressed. Via telehealth, it's less intimidating. They can kind of, you speak to them in a language that's familiar, like they might talk to a friend at the pub. It feels a bit different, but the idea is about, reducing stigma and making it more accessible and normalizing that as a common issue that men face, and hopefully getting a great outcome.
Getting a solution, for them. Yeah, absolutely.
My role was, I did do some consults, so I saw both sides of it, but my Monday to Friday job was working in the kind of the medical operations team, which is like the system that underpins that. So working on the guidelines and governance structures to make sure that, in a telehealth consult, you're making safe and appropriate decisions, you've got appropriate referrals back to GPs and the rest of the system. And, how do we train people to do a great telehealth consultation, because it's a skill, and how do we measure that, and how to I guess they had about 150 clinicians at one point. How do you as an organization ensure consistency of decision making and experience across 150 clinicians? And because it's digital, everything is visible.
Sure.
Which can sound really scary, but actually it was really amazing to see when you're able to give clinicians as a cohort feedback on this is the dream path, and this is what we're aiming for, and this is where we're falling short. That feedback is not something that you get in medicine. So then seeing that then change and evolve, and the kind of the quality and care and the kind of treatment path, for lack of a better word, of a patient, we were kind of very quickly able to iterate on that, which is really cool.
Do you think in that way that the clinicians were then brought along the journey? Because I contrast that with working in hospital or working in a brick and mortar primary health setting. sometimes you're there doing a job, seeing patients day in, day out. And if you're being kind of compared to, in a nice kind of way, I guess, and the norm, but also the vision of where the whole company wants to go to, does that bring a different incentive? Do you think people feel more part of the business, or?
I certainly think so. And I mean, I guess I'm biased because I was on the, I hope that was the effect. I think elephant in the room, I'm not a GP, and I was giving GPs feedback. So, I was very anxious at the start about making sure that the feedback was respectful and based in comparing them to a cohort of GPs and peers and just having a constructive conversation with a peer. And I think, generous assumptions, always assuming the best in people, but also then earning that trust and being like, this is not punitive. This is about making you be the best clinician you can be and about getting good outcomes. And what I mean by that is, because everything was visible, we could see, for instance, if a doctor's prescribing behavior started changing. So there's like an archetypal patient, they would normally prescribe with the kind of cohort mean or median, but all of a sudden there's variance. And it's like, well, that's an opportunity for a conversation. Why did you do that? I had this patient that had a really bad outcome. I'm now a bit nervous kind of with that kind of patient with that kind of archetype. And we're like, well, in medicine, you can make all of the right decisions and still get a bad outcome. Or you can make bad decisions and the patient might not get a great outcome, but they might not get a horrible outcome, which we're trying to avoid. And how do we as an organization support clinicians when they've made a good decision and they've got a bad outcome, but to then continue to make good decisions despite that bad outcome? And because we had such a large volume of patients, it was actually really helpful because we could be like, hey, you've treated in the last 3 months 1,000 patients with that kind of demographic. And don't change your medical decision making for one bad outcome when all of these other patients had incredible results and continue to have good results. So that was really interesting. And it's just the feedback
bias that our brain sticks to, isn't it, for those individuals?
But it's totally human nature. And you're like, you've just been burned by this. I want to avoid that. And and then absolutely, we want to avoid that too. But also by not making the best decision for the patient because you've been burned, you're actually depriving that patient in front of you of potentially a great outcome as well. So it was really encouraging to see how receptive and how much clinicians valued it, and to be able to show that in the data and I guess show that when you set clinicians up for success, you get a great commercial result, not because you're doing it for the wrong reasons, but you're doing it for the right reasons with the right motivations, and making the patients kind of the center of what you do still has, equate to really great commercial results as well, which is obviously the goal in any business, but it's kind of feels a bit dirty to say out loud, if that makes sense.
Sure. Yeah. Well, congrats with all the success that you can. I believe that's been sold.
It's pretty wild. It's been a great result, and then I guess after 2 years of being up in Sydney, I wanted to come home. Is the kind of the shorter end to that story, and I'd started using Heidi whilst locuming and was kind of blown away by the technology, and annoyed Tom and Leah enough to get a job eventually, and the rest is history. So. Yeah, it's been a really fun ride.
Awesome. Yeah, no, that's so good to hear. So, lots of different areas you've worked in, and tested different things out, and thought about that work-life balance as well of what works for you, I guess, and what doesn't work for you, and maybe determining that you don't actually really want to be at the coalface so much. You want to be at this other sort of innovation. Well, entrepreneurial, but you're in a big company rather than solopreneuring. Yeah, really exciting. So I guess why do you think it's important for the medical workforce to sort of stay well and sustainable? And I guess through your different zones that you've worked in, Ben, what do you think contributes to the clinicians staying well and staying sustainable? Because the whole thing about burnout is that people often think quitting is the answer. I'm going to leave this place, I'm going to get out, or leave my medical career and get out of it completely.
Yeah, I think the thing that I glossed over there was at the end of that emergency stint and pandemic, I was entirely burnt out. And I think I have had a bad relationship with burnout across my career, whether through medical school, like burning out at the end of second year and not recognizing it. And then just kind of, just feeling like the only way through is just grinding it through. So I've learned the hard way that, it will catch you. And it's caught me a few times. So, I think the thing for me, that stood out was when I didn't have a sense of like alignment with like purpose, and like when I was kind of doing a lot of that emergency work, not really knowing where I was going, it was very difficult to like, absorb the kind of the system failings and the kind of the crazy rosters and all of the night shift and all of the stress, because it's just, I wasn't feeling like it was aligned for me. And I think the difference when I look to a lot of my peers who are, especially training or finishing, there was like, for them, it was always, there was just like, this was for their space, and like, having that sense of purpose and resonance for them was kind of what carried them through the hard bits. And I think I found that in health tech, trying to just make the system a little bit kinder to clinicians, if I'm honest. Like that to me, like the way I kind of view what I'm doing at Heidi and what I was doing at you, because if I can be a part of a company that makes it like a little bit easier for every clinician to be 5 or 10% better versions of themselves, that's like that impact will be disproportionate to what I could ever achieve as like a single clinician across a career.
Yeah.
But I think the thing that I now try and focus on is just like, I think I've acknowledged to myself that I like being busy and I like the chaos as part of the appeal. I'm a bit of a workaholic, but calendar management, scheduling an exercise like I would a meeting, treating it with the same commitment that I would with a meeting or an interview or whatever, actually showing, not kind of shortchanging myself, and then having some like flags in the ground, I call them, like in the calendar to like look forward to. So once a month, like where am I going to dinner with my closest friends, and when they're all working shift work, and most of them are clinicians. So it's hard, but like we all just put like that flag in the ground. So like, where are we going for dinner in February? And it's in the calendar and it doesn't get moved. And similarly, like recognizing that one big holiday a year was great and it's awesome to go see some places, but having to wait 11 months for your next holiday, not sustainable. So, being a little bit more thoughtful and, having a couple of long weekends booked in and intentional time with my partner and friends and family. Like, it sounds silly, but I find just like having things to look forward to makes the long days, a lot more achievable, and it gives you room to breathe and come up to the surface. So I think that's how I navigate it. I think why it's important, I think like all of the science says that like looking after yourself and putting your own oxygen mask on, to steal that analogy, is like the only way to make a career like in such a high stress, dynamic, pressured environment sustainable. And I think there's so much pressure that like, if not me, who and when, and like there's this acute pressure on like showing up for our patients. But I think we are very bad at like, as a profession, as a caregiving kind of cohort, whether you're a doctor or a nurse or allied health person, like I think we're almost trained, maybe guilted into putting ourselves last. But to make it sustainable, and to make it, we're not aiming for a 5-year career. You want it to be a 30+ year career that's fulfilling and challenging and all of that. Like we need to make sure that we're looking after ourselves. And I often used to joke that I'm a do as I say, not as I do type doctor. Like, yes, sleep is really important, as talking to the surgical registrar who's on call, not sleeping. But I think more and more I'm realizing that like actually practicing what we preach to patients is just common sense. Like it's not even that profound, really. It's just obvious. Yeah.
Yeah, sure. Yeah. No, but so many common threads through that of you're irreplaceable, you've got to keep going. No, there's not enough fat in the system, or we've got chronic understaffing and high workloads. I can really agree with you with some of that sort of silent curriculum that comes in even in med school, which is fascinating that you referred back to a sense of burnout at the end of second year, when I guess you probably weren't even in a clinical
No,
setting.
it was just the preclinical grind of like,
Wow.
exams every kind of 6 to 8 weeks and just trying to absorb so much content whilst also trying to learn on like a 3-hour shoot every Tuesday, all of the clinical skills needed to not embarrass yourself in front of a patient the next year. Like you were so close. It had been like 6 years of study at that point to like be nearly within scratching distance of being in a hospital. It was terrifying too. I was like, I've got no idea. Like, I don't know how to take a history.
Yeah.
So I think it's just this swell of like pressure that you put on yourself, but also just like acknowledging the volume of content that was required. It was just pretty relentless. Yeah.
Yeah. So great that you've got the flag in the sand or the plans through the months and the holidays and mini breaks. I think that's wonderful to look forward to. Are you across sort of what your warning signs are if you're drifting down the roller coaster of burnout? Because it sounds like you've been there more than once.
Yeah.
So you're in a different company now, 2 years in. There's huge growth going on in Heidi. Congrats with all the exciting things globally going on there.
Yeah, no, it's really exciting.
What are you looking out for in yourself?
I'm really lucky because I go to therapy every week just to kind of keep on top of it. I think it's just helped me hold a mirror up to myself. So I think I'm getting better at spotting those warning signs. And I've got a really supportive boss who's always checking in, which is really helpful. But I think for me, it's I'm a bad sleeper at baseline. When I'm tired and stressed, and particularly with lots of travel recently, I'm an even worse sleeper. So rumination creeps in. I think for me, it shows up in like self-doubt, like that silent self-doubt. Like I'll go from a meeting and I'll be less decisive, or I'll like second guess, how did I say that the right way? And that kind of then very quickly can kind of absorb your whole day, where you're like kind of playing this game of did I, didn't I? And it all becomes a bit foggy. That to me is like, you need to clear the afternoon and do something different, go for a run, get to bed, and just be a little bit intentional and like taking a break early. I think that's the big one for me, really. And I think it's sleep, it's just the sleep, but recognizing that creeps in as self-doubt more than anything. Because I think what would then happen normally, or before I would intervene, is like that then the self-doubt, the rumination, makes the sleep worse. And it's just like you all of a sudden get into this kind of pretty like grim cycle of rumination, sleep deprivation and stress. So that's the big warning sign for me. And then I also notice now that I've like, if I'm really busy and kind of the pressure's on, maybe the exercise falls off the plate for a couple of days. But if I've done that for a week, I'm like, okay, if I can't find 40 minutes in the day to go for a run, like that's a flag.
Sure.
Or maybe not a flag on a singular day, but if it's 5 days in a row, then okay, there needs to be a realignment here. So, I think just having the space with a boss who you can have those chats with, and we talk openly about balancing the speed and the breadth of stuff we have to be across with everything going on at Heidi at the moment, with like the key is not to burn out here. Like,
fantastic.
So how do we
really talked about openly?
It's explicitly spoken about, and I think we've seen it enough, whether it be in ourselves or just in the profession, that like I think it's just it makes sense. Like if the work's sustainable for us, we can get the outcomes we want faster in many ways. So in some ways, I think it's just I think it's really healthy dynamic, which I'm really grateful for.
Yeah, no, great. So good to hear what works, and that leadership is supportive and maybe being an example. I mean, I guess you're a leader in the team as well, but sort of being that example of your own vulnerabilities and picking up on what's shifting for you. Okay, it's time for me to really take some action now. I might be finding it hard to make decisions at work or whatever, but I can see I just need to cut myself some slack, get back out on the footpath or beach or wherever you do your exercise. And I think it's really important to just be able to to know yourself and trust yourself, that you'll start taking that action for yourself so that you can show up better in your whole life, not just work. But
no, absolutely. And I think that's so true. It's like I think the thing that's been really cool to have people around you to kind of help you see that sooner, but then to take the 3 hours off, go for a run, get a bit of sleep and come back the next day and just feel better. Like the feedback loop is actually there. Like I think it's like you kind of deprive yourself of seeing how much better you could feel if you avoid that. And I think it's really, touched on the fact being a leader, I think it's been nice to feel the support that I get from above, but also kind of, it's very easy to just be like, go home. When to someone who's kind of starting out their career. So to kind of pay that forward as well. But yeah, it's a work in progress, but it's good fun.
Yeah, no, that's great. So, I always ask my interviewees, what's a self-care practice you rarely miss? I
think I wanted to be honest. I saw this question and I'm not actually very good at being like consistent. I think rarely miss for me is don't miss more than 2 workouts in a row rather than don't miss one. And I think for me, it's the social connection that I think about. Like I think the reason I moved back from eucalyptus from Sydney was just because of I've got 5 brothers and I'm really close. I got a very, very lucky to have a great network of friends here in Melbourne, and the disconnection from that was really challenging. So that social connection piece is probably the thing that I'm really intentional on. That's how I recharge with other people. And as I mentioned, I'm a pretty bad sleeper, so I try my best to go to bed consistently and optimize, but it remains an Achilles heel. So I think the thing that I would say is I'm trying to be kinder to myself when I get it wrong. I think I put my own worst critic a lot of times, and that can just make things worse. So that would be the other thing that I'd say I'm trying to do more consistently.
Yeah. No, I love hearing that, like if we can call it support or connection, the social or the impact of having a good social group and going to them and staying connected with them. That's so good to hear. Not many of my interviewees have said the social network.
Yeah, I think it's so important. I think particularly as I was contemplating leaving the hospital, like you feel like a bit of a pariah. And even 4 years ago, it was more so. Like genuinely, it was like people like, what are you doing? Like you could be on a training program. Like you're nuts. But it was my friends that were in medicine that were like, you're not happy, but also you could be brilliant at this if you just gave yourself the chance to. And that's kind of like, you hope that that's how your friends show up for you, right? But it's really special. And I think particularly for me, like that's how I fill my cup. So having good people around you makes the world a difference.
Well, Ben, I'd say this has been a pretty short and sharp, but very insightful and meaningful interview. Is there anything you'd like to leave the listeners with today as we round out this episode of the Burnout Recovery Podcast?
I'm just really grateful to have the opportunity to kind of share my story. And I think the more we talk about it, hopefully the more normalized it becomes. And I hope me trying to look after myself better, if it helps somebody else, then that's all you can really ask for. So thanks for the opportunity to talk, Joe.
You're so welcome, Ben. It's been great to have you on the podcast. And I also wanted to say thanks to Heidi for being a sponsor of the podcast as well. It's great to have the collab with you guys. That ripple effect that so many different things can do for those of us in healthcare. And I say that broadly, not just for medics, whether it is having the care partner of an AI scribe, if I can say it that way, whether it's having a therapist who's in your corner and you're seeing them weekly. I have a coach who I catch up with weekly, your support network as well. And then that sort of vertical and maybe horizontal openness and communication with your peers and colleagues in the workplace as well. I think there's so many gems of how those multiple different parts of the jigsaw puzzle can really help us with that ripple effect across healthcare.
Yeah, sure. I mean, that's why we're doing it. So yeah, it's a pleasure.
That's great. Thanks.
Thanks, Joe.
Ready to take the next step in your burnout recovery journey? Visit drjoebraid.com for free resources, all 150 plus podcast episodes, and information about my keynote speaking. Links are in the show notes. Your well-being matters. Protect the asset that is you. You know those moments where you're between patients, everything's moving fast, and you just want to double-check something without falling down a rabbit hole? Heidi Evidence helps you to get to a clear answer with citations you can see pulled from trusted guidelines, research, and even your own uploaded docs. It's completely ad-free, no sponsored results, no weird ranking, and it's unlimited, region-aware, and fits into the workflow you're already using. It supports your clinical judgment. You stay in control. Find evidence in the chaos. Search HeidiHealth.com. Be your best you. Rely on MEGA for your protection and support, serving doctors for over 125 years through insurance, education, medical legal advice, and member benefits designed to help you thrive and succeed. Insurance issued by Medical Insurance Australia, which has not taken into account your objectives or situation. Before you make any decisions about our policies, please read our PDS and consider your needs. Call us for a copy or visit mega.com.au.